Welcome, everyone, to our monthly patient education webinar. I'm Kathy Nickham, the Education Director of the DPC Ed Center, and today's webinar is on learning to thrive while living well with the chronic illness. Let's go over a few housekeeping tips before we go any further. All of your lines are muted. You are welcome to ask questions or make comments through the chat box, and there will be opportunities throughout the program to interact with the presenter. She'll be asking for some comments, and you'll find the chat box up in the far right-hand side corner of your computer. You'll also receive the link to the recording and the slides, usually within a week, and there will be a feedback form that is through SurveyMonkey that will be in the chat box at the end of the program. It's also listed at the beginning of the program. Hannah will put it again at the end of the program, and we would appreciate your completing that for us and giving us some feedback. At this point, it's my pleasure to let you know that we are doing this webinar in partnership with the American Psychological Association. And Jewel Edwards Ashman, a senior editor at APA, is going to introduce the speaker for our program. Jewel?
Hi, thank you, Kathy. Hi, everyone. My colleague Annie Hamill and I are so pleased to continue this annual tradition with DPC of doing a webinar for your members and your families during Mental Health Awareness Month. As a former dialysis patient and a two-time kidney transplant recipient, I know how important it is to pay attention to your physical and mental health. So I'm very pleased to introduce our presenter who is very knowledgeable about strategies related to living well with a chronic illness. Dr. Mana Ali Carter is a licensed psychologist at MedStar National Rehabilitation Hospital. She specializes in helping individuals cope with various physical and medical conditions and achieve optimal quality of life. She also serves as the Director of Training for the Rehabilitation and Pain Psychology Fellowship. Thank you, Dr. Ali Carter. Take it away.
Thank you so much for that introduction and the opportunity to present at this webinar. And thank you all for being here and your attention. You can go to the next slide, please. So today's webinar will highlight various themes that are relevant to the experience of individuals managing a chronic illness or chronic disease, their loved ones, and those just generally interested in understanding aspects of their lived experience. So we'll discuss burnout, grief, coping with uncertainty, trying to balance it all, and resilience. Next, please. But first, I want to invite everyone to just relax. Let gravity pull you into wherever you're sitting or lying. Drop your shoulders, unclench your jaws. Drop your tongue from the roof of your mouth and take a breath in through your nose and out through your mouth. And I invite you to notice any tension in your body and feel free to continue to monitor your tension and prompt yourself to relax throughout this presentation. Next, please. So I'm going to start off with introducing this model that you see here. This model is a continuum, and it was actually created to help train firefighters and emergency personnel, but it translates well to stressful everyday experiences and certainly the stress of managing a chronic condition. So green, the furthest left on the continuum, represents thriving. Many of us want to be in green and stay in green. This is when we feel calm, we're able to manage the stress that life throws us. But the reality is, we may not always be able to stay in green, but we hope not to be out of green for too long. Yellow is surviving. That is, you may notice and feel the impact of a stressful situation. You may feel overwhelmed a bit, maybe sad or frustrated. Sleep might be impacted, but you're reassured that the stress will pass and you'll eventually return to green. So an example of this may be hearing from your doctor for the first time that your blood sugar is high. Stressful for sure, but you know you can work with your healthcare team. There's medications, there's things you can do to manage it. So you'll get back to green soon. Orange is struggling. Now the stress is persistent. You're feeling emotionally exhausted. You can start to feel changes throughout your body. You're noticing changes in your behavior. Maybe you're drinking more or you're sleeping less. And there's interference with things that are meaningful and important to you. Like maybe you're noticing the impact on your relationships or disruption to your daily activities. An example of being in the orange may be the state of stress that you experience and the financial difficulty when you're unemployed longer than desired. Red is crisis, fire, right? The symptoms that you're experiencing from the stress are so severe that you could meet criteria for a mood disorder. The symptoms are getting in the way of living a full life, and this is prolonged and it could require attention from a mental health professional. Things feel hopeless, unmanageable, you can't see a way out. There's rarely the experience of positive emotions, right? So I invite you to just monitor where you are right now on this continuum. If you feel inclined, put it on the chat so we can normalize each other's experiences. Next, please. So, chronic stress, right? The stress that we experience on this continuum, right? It has a negative impact on our body systems. Simply stated, stress makes us sick. So, I invite you to imagine being in the open plains in Africa, right? Now you see a lion coming towards you. Your body is going to have a reaction to that threat. Each of the systems identified in this picture is going to respond. You'll feel fearful, your heart and blood pressure might speed up, your muscles become tense, your breathing changes, you feel your stomach drop at the sight of this lion. In chronic stress, your body remains in this state, right? There's no lion, but your body is responding to the chronic stress of managing a condition or other chronic stressors. And think about what happened if you never turned off an appliance. The battery is going to drain and the parts will wear out, right? So this chronic stress response is one that we want to avoid. Next, please. So how does this stress response really apply to living with a chronic disease like kidney disease or caring with someone with a chronic condition? Well, chronic disease management is stressful. And the key word here is chronic. It's ongoing. It's the lion that's in front of you that never leaves. The disease course can be unpredictable and uncontrollable. And living with this uncertainty is stressful. Managing or helping loved ones manage chronic conditions can have disruptions to your relationships, employment, and other meaningful parts of your life. That's stressful. And the cumulative effect of managing the daily tasks like appointments and eating the right foods and making sure you get your medications, that's stressful. So, to say the least, I'm probably preaching to the choir here. Having a chronic condition creates, unfortunately, the opportunity to have prolonged stress. Next, please. And grief is stressful. Most people think of death of a loved one when we think about grief. However, there is a grief process of chronic disease management, right? By the individual who has the chronic condition as well as their loved ones. You may grieve the loss of independence, bodily function, employment, relationships, and so forth and so on. But one can even experience grief of things that haven't even come to fruition yet. So, for example, maybe you were diagnosed with a chronic condition or had to become a caregiver, and now you have to abandon the idea of what you thought retirement would look like or your vision of what you thought it would be like to be a grandparent, right? One can even experience what we call anticipatory grief. So this is kind of being on edge, just waiting for the next devastating thing to happen, the next bad outcome. So, an example of this is maybe you haven't started dialysis yet, but you're already anticipating how it may change your life, and you start to have an emotional experience related to that. There's no blueprint to grief, right? It's famously discussed in stages, but you may notice from your own experience that that does not capture it. The picture on the right is probably likely what this has been like for you, right? Lots of emotions, an emotional roller coaster, feeling overwhelmed. And if you feel inclined, feel free to share in the chat things that you've lost, a little bit about your grief process. Next, please. So we have this stress, right? We have the stress of managing a chronic condition, and boom, here comes the pandemic. And the pandemic just added to the pile of stressors. If we weren't drowning in stress, maybe the pandemic made it more likely that we were. So superimposing on the stress that we already had are added responsibilities from the pandemic, right? So who's going to do the grocery shopping? Constantly disinfecting, caution fatigue. So that means just always being hyper vigilant and cautious, and that is exhausting, that's stressful. Trying to make sure that you aren't increasing your risk for infection because you're afraid of poor outcomes. You may notice during the pandemic, your dynamics have changed with providers, right? There's teletherapy offered now, which is convenient, but it also has been shown in research that some patients have increased uncertainty around decision making since they can't see their providers in person. Because of, attempts to try to mitigate risk, we've reduced the amount of pleasurable activities that we're engaged in. You may feel more isolated now. You might have noticed changing support. So there's a shortage of health aides, there's a shortage of nurses. Maybe you weren't a caregiver initially, but because of the shortage, you were thrust into that role. These are all stresses, more stress that the pandemic brought on. Next, please. And I've been talking a lot about stress, but the truth is that there are mixed emotions to managing a kidney disease or chronic illness. Some people feel relieved when they finally get the diagnosis from their doctor. They feel reassured that now there's clarification of what's going on with the symptoms that they were experiencing. Maybe folks feel hopeless when they know that they can start dialysis or receive a transplant. But nonetheless, it is stressful. Research has shown about 25% of people who have chronic kidney disease experience symptoms of depression, and 20% experience symptoms of anxiety. Research has also shown that there's some variation in emotional responses based on the type of treatment that one is undergoing for kidney disease. So, peritoneal dialysis report poor physical health, yet higher satisfaction with care compared to persons who are undergoing community-based hemodialysis. And about 35% of individuals on dialysis report depression, compared to about 13% of individuals who aren't on dialysis. But I want to really emphasize this next bullet because even though there is stress associated with dialysis, right? Research has shown that it's stressful at the outset. There's a lot of uncertainty, it's unfamiliar, it's scary, but eventually quality of life improves per report of the person undergoing dialysis. So there is hope. Next, please. And those who, again, mixed emotional responses to kidney disease, but again, those who feel overwhelmed and sad and fearful, it's justified, right? Think about the complications of renal replacement therapies. It's not easy. You're tired. You have dry skin. You're itchy. You're in pain. You have numbness. There's decreased interest and opportunity when you're undergoing renal replacement therapies or managing a chronic condition to do meaningful and pleasurable fun things. And we know that meaningful and pleasurable activities increase positive emotions. Maybe lost the opportunity to work. You've had a change in identity, a change in life plans. And another thing that I hear a lot that's very stressful is for individuals who feel like a burden, individuals who are requiring more help. They feel very guilty about that. Next, please. Research has shown that there are factors that make stress worse from those who are managing kidney disease or make stress better. So females report higher symptoms of stress than males. However, I want to emphasize report doesn't mean that they're actually experiencing more symptoms. They just report higher symptoms. So we know that family having a sense of connectedness, having social support is associated with lower stress in persons managing kidney disease. Availability of resources, right? The quality of care, availability of good nurses and education, that makes stress less. Disruptions in sleep. So if you've developed a sleep disorder like insomnia, being tired, that makes stress worse. Spirituality, a sense of connectedness makes stress better, meaning that you experience less stress. Exercise or activity within your ability makes stress less. And there's also research that points to individuals being diagnosed at stage 3 of chronic kidney disease or above tend to report more stress. Next slide, please. So caregivers of loved ones who are managing chronic kidney disease also have stress, right? We call this, you might have heard it, it's called caregiver burden or caregiver burnout or caregiver stress. But overall, the frequency and length of time of dialysis, right, has been associated with higher caregiver stress. So care recipients undergoing hemodialysis is associated with more reported caregiver stress, right? And this is compared to caregivers of loved ones who have had a renal transplant or haven't had dialysis or at all or have peritoneal dialysis, excuse me. But despite the stress associated with the start of dialysis for caregivers, right? Caregivers report an improvement of quality of life over time, right? This is the same trend that we saw in the previous slide, that over time things get better, that there is hope. Next slide, please. I love this slide personally because, again, what I hear a lot from patients is I feel like a burden. I've lost my independence. I, am causing stress to my loved ones. However, there are benefits of caregiving. Caregiving is a labor of love. Caregivers report that they appreciate caregiving because it makes them feel needed, it provides a sense of meaning, they've learned new skills, it's created opportunities to strengthen relationships with others, they feel accomplished, they feel able to manage things, they have high self efficacy. And there's some evidence that helping others, that caregivers, can have lower mortality by 5 years. So meaning that they may live 5 years longer than those who are not in the caregiving role. Next, please. So again, there's some factors in the research that have been shown to moderate caregiver stress. So we know caregivers that have lower socioeconomic status, so less access to resources, they have report more stress. The prior health status of caregivers also impacts the amount of stress that they experience. So if they were managing their own chronic conditions and now they are engaged in a caregiver role, they may report more stress. Caregivers of older age report more stress. Female caregivers report more stress. Single, not in a relationship or not married, report more stress. The availability of support, resources, social support, dialysis nurses that they can depend on, that makes stress less for caregivers by their report. Also, caregivers report more stress depending on how the care recipient is doing. So if the care recipient has more depression or more anxiety or less functional ability, the caregivers report more stress. And the relationship between the caregiver and the care recipient is an indicator of stress. So if there's a spouse caring for their loved one, they tend to report more stress versus, let's say, a spouse caring for a friend or caring for a sister or caring for a child. The perception of their loved one's suffering is associated with more stress. So if For example, the person who is managing the chronic condition, the individual with the chronic condition is having more pain behaviors, more yelling or rubbing. If they're having labored breathing, if it's more visible signs of distress, the caregiver is likely to report more stress. In spirituality, again, having a sense of connectedness with something outside of yourself, a higher power, it's been associated with less stress reported by caregivers. Next, please. So we know that stress exists. We've sort of went over, reasons that stress exists for persons with kidney disease and caregivers. But we also know that those who have kidney disease don't always disclose how they're doing. They don't always tell the nurses or the people that are available to help about their stress. And many persons with caregiver of kidney disease, also report just feeling unprepared for the emotional distress. They had no idea that they would experience all of these emotions while managing their chronic condition. Only 56% of caregivers are aware of their tendency toward depression. Now, this slide really, I think speaks to the fact that we need to be talking about the stress. We need to be educating about the stress. We need to do something about the stress because people aren't talking about it and people aren't even recognizing it sometimes. Next slide. So, what is prolonged distress, right? What is burnout? What is being in the red or orange for you, right? And it looks different for different people. Sometimes chronic disease burnout can manifest emotionally. And I should mention here that many people, when they hear that word burnout, it's usually associated with workplace burnout. In fact, the World Health Organization even recognizes burnout as an occupational phenomenon, but you can for sure have chronic disease management burnout. So again, it can show up in different ways for different people. Emotionally, you may experience prolonged worry, fear, irritability, sadness, anger, mood swings, sense of helplessness or hopelessness. It might manifest cognitively. Maybe you have difficulty concentrating or trouble remembering, feeling stuck or in a fog or confused. Or maybe it manifests in your body. Maybe you're noticing more aches and pains or tension in your body, changes in your appetite, trouble with sleeping, just general fatigue. Or it could show up behaviorally. So if you have prolonged stress that leads to burnout, maybe you're having increased substance use, more smoking, more pacing, being more snappy with loved ones, withdrawing from things and activities and people that are important, not engaging in self-care, giving up. So I encourage you again to take a pulse on what your signs of burnout might be. This is a good time to reflect and think because again, it may not show up typical. And again, if you feel inclined, please put some of your burnout signs in the chat, right? It might help others think through what burnout looks like for them. Next slide, please. So let's shift the discussion a little bit, right? Let's talk about how to get out of the red or orange, yellow zones into the green zone, right? From the model of stress that was used for firefighters that was presented earlier. How do we start being intentional about thriving? Next slide, please. Well, first, I think it's really important that we all broaden our view on how emotions exist, okay? We get messages throughout our life that make us think emotions exist in an either or fashion. We think about emotions in isolated categories, like we're happy or we're sad, we're weak or we're strong, we're fearful or we're brave. When we think about emotions in this fashion, it doesn't allow us to see that all emotions can exist together. And if we don't recognize this, we're more likely to focus only on our negative experience. Animation, please. So one can be sad, related to loss of independence, and grateful for social support. Our emotions look more like this. They exist together. You can be worried about your disease course and courageous enough to persevere through uncertainty. We can feel sad and frustrated and tired while we are thriving. That's important because I want people to know that having negative emotions do not mean that you are not thriving or you're not resilient. Next, please. So again, feeling negative emotions and resilience can exist at the same time. Next, please. Humans are resilient naturally, right? This is what I love about psychology, because this is a jewel that I get to see from my work. I see people in their most, sad and tragic and traumatic states, and they persevere. Resilience is central to our well-being, and it helps with battling burnout. Resilience is our ability to bounce back from illness or hardship and adapt to change. And if you are here in this moment, you are resilient. The way life works, you're either in a problem, you just got out of a problem, or you're about to head into a problem, right? So this is why I said you've managed difficulty. If you're here in this moment, you are resilient. And if you feel like your resilience is wavering, it can be strengthened or further developed, right? Strengthening resilience, it requires being proactive. And that's an important word, because being proactive means you're not waiting for something bad to happen or a stressor to come. You're sort of self-monitoring. You're bringing self-awareness to your space. You're taking a pulse on how you're doing. Developing resilience takes self-regulation. So that means understanding, learning, implementing strategies to manage your emotions and stress. And if the strategies that you have don't work, being confident that you can find new strategies. Next, please. Factors that promote resilience are listed here on this slide. Now, there are factors that you can cultivate and practice to help strengthen your resilience. But I will say that sometimes more important than the tools that you have than these factors is your sense of resilience, right? You can have everything on this slide. You can have, hopefulness. You can have a strong support system. You can have problem solving abilities. You can have good spirituality. However, if you don't think you can use them, or they will work, if you don't think you can get through a tough situation, it doesn't matter what tools you have. It will be that much harder to persevere. So it's nice to have the factors that promote resilience. It's nice to cultivate and create and find these factors, but it's also important to believe that they work, to believe that you can get through a chronically stressful situation. Next, please. It doesn't take magic, right? Or some complicated psychological intervention to strengthen your resilience, especially when it comes to managing a chronic condition. There's some practical tips here that I want to empower you to utilize. So the first is ask questions. When you have more information, things don't feel as uncertain. And when things don't feel as uncertain, you have increased confidence or self-efficacy in managing the condition, right? And not only should you ask questions, you should ask for answers in a way that you can understand. So adapt the information. For example, if the providers are using the fancy medical jargon that you don't understand, ask them to rephrase. If English isn't your first language and you aren't quite understanding, or you think it could be simpler to digest the information in your first language, ask for a translation, right? If you have difficulty reading, right, ask for pictures to explain some of the concepts, but be empowered. You are the expert on you. And managing a chronic medical condition is the meeting of the two experts. It's the meeting of you, it's with the provider. So you have to be able to be an active participant in that process. So please ask questions. Also, just ask for help when you need it. And this goes for persons managing chronic conditions as well as caregivers, right? So ask for help sounds pretty simple. Just ask someone when you need something, right? But asking for help is really complicated. And I've learned that a lot of people don't really know how to ask for help. So just think about yourself. How many times have you told someone, oh, let me know how I can help, or let me know when you can need what you need? Your intention to help is there. However, that person that you're talking to probably never told you what they needed. And we do the same thing. So when you're asking for help, be specific. Hey, Tom, do you mind coming by Tuesday at 7:45 to take us to Market Street? Like, you have to be specific and you have to tell people what you need. Never worry alone. This is hard and heavy stuff. Managing chronic conditions, being a caregiver, it's a lot. It's too much weight sometimes. And having people who can support you, loved ones, family members, community, church groups, trusted medical or mental health providers, it makes it feel a little lighter the weight, right? There's support groups and information and other resources available at National Kidney Foundation, as well as Dialysis Patient Citizens. And I encourage you just to explore what's out there so you aren't worrying alone. Next, please. Okay. So I'm going to stay on this slide for a bit because I think self-care is so important. You'll see memes here that speak to self-care not being selfish, that you can't pour from an empty cup, that it's not self-indulgent, that you shouldn't feel bad about taking care of yourself. But I often, struggle with getting people to tell me exactly what self care is, right? So many of you here, take care of yourself. Self care is so important. We heard that a lot through the pandemic. You probably hear that a lot from providers. But what exactly is self care? And to me, it's living a fulfilled life, right? I don't have a more specific definition. I'm sorry. Because I believe that fulfillment should be defined by you for you, right? Most people, when we think of self care, especially for those who are managing a chronic condition, it often gets collapsed into health management tasks, such as going to doctor's appointments or taking prescribed medications, attempting to get bouts of uninterrupted sleep. And for those managing chronic conditions or even caregivers, self care can get collapsed into hygiene tasks such as bathing or brushing your teeth or just getting dressed for the day. And, I am not arguing that these tasks are not critical. These tasks are important to daily living. However, the self care that I'm suggesting that we think about is not defined by hygiene tasks, right, or health management tasks. Those are important. But the self care that I'm asking you to think about or tap into are activities that are consistent with your values and activities and practices that leave you with a sense of purpose, meaning, enjoyment, a sense of freeness, right? With all the urgent matters that may come up with managing your health, it can seem inconvenient to find time to laugh or unimportant to get a pedicure or spend time with good people or to go outside or whatever your feel good thing is. It can feel inconvenient, like one more chore. But I want to emphasize that self care feels good. It feels really good. And so that can be your measurement on whether you're actually engaging in a self care task, right? Self care is not a one and done thing. Self care will evolve with your resources, your abilities, your desires, your values, trial and error. And, the one thing that I'm going to emphasize about self care is the self in there, right? That people are accountable to initiate self care tasks, right? And even if you're someone who requires help with physical activities, it is still important for you to think about self care activities that you can initiate on your own because that's going to help you feel more in control. That might be using your mind more, right? Self care requires an open mind. And again, I get it. As a psychologist, I work with people who are in crisis mode, in the red. How can I possibly think about, you know, having fun when I have to go to dialysis all the time, or I'm trying to secure income, or I'm trying to figure out how to parent my teenager. And, I want to emphasize that engaging in self care tasks does not take away objective stressors that you may face, right? Dialysis will still be there. Your teenager will still be giving you a headache. Financial hardship may not go away. But what self care does is it equips you with the spiritual, cognitive, and emotional reserve that you need to persevere through stressors, right? Self care helps with resilience, it helps with battling burnout. You have to be intentional though. You have to be intentional about pouring into your whole self. It has to be deliberate. Self care has to be something within your control. It's not going to fall from the sky onto your lap. You have to be deliberate. Next slide, please. So, what can fall under the big self-care umbrella? Well, it can be recharging activities. This can be exercise. These are things that are energizing, stimulating, engaging, like maybe singing or adaptive rock climbing or whatever it is. It can be recharging. It can be relaxing. So this might mean doing some yoga or praying or meditation, something quiet, calm, and soothing and resting. And then the one that I find is often neglected is reflecting. Self care can be reflecting, connecting to yourself, connecting to energies outside of you, trying to find understanding, trying to find the purpose of life, trying to process your values, wondering, being curious. That also counts as self care. And so, again, I invite you to think about activities, things that you can do under all of these categories. Next, please. So again, the other thing I hear, self-care just feels like one more thing to do. Like I have all this stuff to do already. Now I have to try to fit self-care into that, right? And self-care doesn't have to be long. It doesn't have to require materials. It doesn't even have to require leaving the house. Most people, when we think about self-care, we have a picture of someone doing yoga by plants and the sunshine beautiful behind them, but that doesn't have to be your self-care. Self-care can be watching reality TV or watching a rated R comedy if that's going to make you laugh, right? It doesn't have to be clean and pretty. It doesn't, and it shouldn't feel like a chore, right? If self-care is feeling like a chore to you, then you want to switch gears. You want to find another activity because if it feels like a chore, I don't want you all to start to condition self-care with negative emotions, right? So, oh gosh, I have to do that self-care thing again. So these are examples of just brief, less than 5 minutes self-care ideas. Drinking water, writing down things about yourself that you like, finding a cute animal online to look at, rubbing your pet, booking an appointment you've been putting off, breathing exercises. So this is not a comprehensive list. These are just ideas. So I invite you all to put your ideas of short self-care tasks in the chat. Things that make you feel meaningful, refresh, free. Again, if you put it in the chat, it might spark some curiosity with other participants today. Next, please. So the other thing that I sort of got at when I was talking about self-care is this feeling that everything feels overwhelming. It's too much to balance. How do you balance life and caregiving roles and managing your chronic conditions and medical appointments and just all these things? The list goes on. And so I think central to you finding the answer on how to balance life is really looking to figure out what your values are, what it brings meaning and purpose to your life. You can do this different ways. Again, I'm not listing every way possible, but one way is to look forward. Looking forward means imagining your life 30 years from now. What do you want it to look like? What is important to you? And how would you live consistently to that? Looking back is similar, except this time you're imagining you're already 30 or 40 years older. So if you're 50, imagine you're 80. And look back, what did your life look like? Are you happy about it? Are you happy about the activities you chose to prioritize? Right? These are the prompting questions that you want to ask yourself when you're looking forward or looking back. You can also think about setting an intention each day. So, waking up every day and being intentional and naming what you want to manifest that's in your control. So, maybe you might set the intention to find humor or express gratitude. But setting an intention at the start of the day, it's a guide, it's a way to be accountable, it's a promise to yourself to help cultivate positive emotions, again, which is going to battle some of the burnout risk, which is going to battle the stress that we feel. Now, to the right of this slide, you'll see some pictures of a jar, rocks, pebbles, and sand. And again, because burnout is really associated with occupational health largely, but we know that's not true. You can definitely experience burnout with chronic disease management or as a caregiver. This analogy is used a lot in occupational settings for time management, but it's definitely translatable and important to, I think, the purpose of this call, right? How to thrive in the face of chronic illness. So imagine you need to fill a jar with some big rocks, some pebbles, and some sand. What do you put in the jar first? The jar represents life, right? And you have to balance it all. You have to fit everything in. You have to fit the rocks, the pebbles, and the sand in. If you start filling the jar by first adding the sand and then the pebbles, you won't have room for the rocks, right? You always start with the big. The big rocks in this case, think about them as symbolizing the things that are most important in your life. And sometimes when you're managing chronic health conditions, this can become narrow. We tend to over focus on health. Health is it. Health is my big rock. That's it. However, if you really reflect, you have other big rocks in your life. Maybe it's spirituality or family or love for learning, but you have other things that are meaningful and want your attention. The pebbles represent everything of medium importance, right? And so, this brings the dilemma of, for example, can I sacrifice a daytime nap, right? Sleep is important to learn something new if, curiosity is a value of yours. And the sand represents all of the smaller items or things you have to do of less urgency, right? And so an example of this might be, can the dishes in the sink just wait another day so I can watch a movie with the person I love? And so the lesson here is, if you don't put the big rocks in the jar first, they will not fit later. If you do not invest in things that are meaningful and valuable to you, and you start to put all the other things in first, like I got to do the dishes, got to clean up, all the things that can wait, you won't have time for the rocks. So again, whatever your rocks, pebbles, and sand are, I encourage you really to think about this analogy, and prioritizing putting your values in first as you choose the activities throughout the day, the things that are really important, and sprinkling the pebbles and the sand after. Next, please. Managing expectations for stress is always something that I like to emphasize because, again, we like to be in green, right? We all like to thrive. We don't want any stress. Life feels good, calm, we're cool and collected. And the thing about this is that is not reality to always be in the green. That the goal should be managing stress versus eliminating stress. I wish I could be honest and tell you that, oh, yeah, managing a chronic health condition gets easier. Yeah, it'll be easy down the road. Or being a caregiver, oh, a piece of cake. The stress will not be eliminated. The goal is to manage the stress. The stress will be there. And I always feel like the bearer of bad news when I say this. And I say this not to deflate your hope, but to increase your sense of resilience, that you can manage the stress. Same thing with uncertainty, that uncertainty will not be eliminated. It's just not. It's among us. So it's about how do I live in and navigate uncertainty versus eliminate it. People who strive to eliminate stress and eliminate uncertainty always feel helpless and more anxious and sad because it is impossible. Next, please. Another strategy, again, to help kind of battle burnout, manage stress, navigate uncertainty, is cultivating awe, right? Awe is looking for beauty everywhere and in every person and in everything, right? It's being amazed by invention or innovation. It's noticing something tiny and something huge. It's looking at the sky. It's being curious, right? And we can do this anytime, anywhere with anything, right? Even looking at your body, just being in awe of how it manages to function despite stress, despite disruption, right? Looking around and just thinking about how fascinating it is to have eyesight or to breathe or looking at the carpet, right? That's a silly example, but noticing how amazing it's threaded together. Like it can be big or little, serious or silly things, but just appreciating everything around us, right? You'll see a link here. It's called Window Swap. You can Google it. Window Swap is a website that allows you to peer through windows all over the world. So people have signed up to be a part of this initiative where they put a camera in their window and you literally have their view. So if they're in a place with a beautiful lake in their backyard and birds flying around, you can see that and it'll tell you the location. A window might take you to Greece or Hawaii or Belize or Australia, but it's an opportunity to see the bigger world outside of yourself and cultivate awe. So that's if you're having trouble figuring out, what you can appreciate or how to notice tiny or big things, you can start there to just be amazed by the universe, right? Next slide, please. Gratitude. Gratitude is a big one. We know gratitude is very protective of stress. So gratitude elicits positive emotions. There is an activity called Three Good Things or Three Good Blessings, and this is by a psychologist named Martin Seligman. And he is sort of one of the pioneers in a field of psychology called positive psychology. Positive psychology could be thought of as radically different from traditional psychology, right? So psychologists focus on psychopathology, what's going wrong, what's been disrupted. Positive psychology, simply stated, focuses on what's going right. What are the strengths? What are the good things? And so this is an activity out of that school of thought. And so the activity suggests that each day, right, think of three good things that happened or three blessings. Again, big or small, three. Write them down if you can, voice note them, say them out loud, and then reflect on why that happened. This is going to cultivate a sense of gratitude. This is going to help you experience positive emotions. Again, we want those positive emotions so we can be filled up and ready to navigate chronic stress. Next slide, please. So this is a bit more complicated, right? This is where if you are struggling with negative thinking, I would encourage you to see a psychologist. But I'll try to do a mini crash course on how our thoughts, when we are managing chronic stress, can influence our mood and our behaviors, okay? So first, let me start off by just defining thoughts. Thoughts are mental chatter, words in your mind, right? And your mood is different from that. Your mood is how you're feeling. And usually those things are related. So if you are having a negative thought, you usually feel negative, right? If I think this chronic disease has changed my life forever in a bad way, I'm going to feel sad, right? If you think negative, you're at risk for feeling negative. By design, okay, we focus on our problems and we think about worst case scenario. And this is helpful when we are actually in a dangerous situation, right? If there's that lion in front of me, I am going to think about worst case scenario. This lion can eat me. I'm not going to think about, if the lion's going to come up to me and play and be friendly. My mind is automatically going to go to worst case scenario. And that's helpful when we are in a time limited, dangerous situation. But as we've talked about here, managing a chronic condition like kidney disease, being in a chronic caregiver role is not acute, it's long lasting. The lion's just in front of you the whole time. So thinking about worst case scenario isn't helpful. It's not helpful when you deal with chronic stress. It's important to note that our thoughts, what we are thinking, is not always the truth. Even in that lion situation, I don't know if the lion's going to eat me. Let's hope not. But I don't have objective evidence for that. I don't have objective evidence. Thoughts are not always the truth. And sometimes our thoughts are based on feeling and not based on fact. Because I'm scared to death of the lion, right? That's a feeling. I'm scared. I'm going to think he's going to eat me. It's not based on fact. I don't have data for the future. And sometimes thoughts are stuck in the past on things we can't change, and this causes sadness, right? So, this is what the next slide, the next bullet refers to: watch out for a wandering mind. A mind that is not in the present moment is a wandering mind. A wandering mind can be too far into the future about all the horrible things that are going to happen, or too far in the past, the shoulda, coulda, woulda. And the wandering minds create stress and burnout. So I encourage everyone to start monitoring their thoughts. Don't engage with them, just be an observer. Okay? When we feel sad or anxious or overwhelmed or hopeless, it's because we're engaging in our thoughts as if they were truth and not observing them. So I'm going to teach you a quick trick to distance yourself from your thinking, right? Not to be consumed or fused with your thoughts. So try this. When you're having a negative thought, so I'm going to pretend I'm having the negative thought that I am a burden. This thought pops in my head. I'm a burden. I'm going to notice it. Next, I'm going to say it out loud. I am a burden. The second step is to say the same thing, but put a phrase in front of it. I'm going to put the phrase, I am having the thought that. So instead, my thought goes from I am having a burden to I am having the thought that I am a burden. And then I'm going to go a further step to push the thought even further and say, I notice I am having the thought that I am a burden. So now I've created distance between me and that negative thought. And now, because of the distance, I've created the opportunity to see it in a new light and challenge it, to recognize that it is not useful to me, right? To challenge its integrity. Could you go to the next slide, please? So this is another quick trick, right? So talking about that stinking thinking. So say that my thought, this is another trick, is I've lost everything, right? And thoughts are ambiguous and intangible. They're hard to see. So it makes them feel scary. But again, remember, thoughts are just words. So this is why I encourage folks to write their thoughts down if they can. So I'm writing down my thought here. I've lost everything. Thanks, kidney disease. I have nothing. I've lost everything. Writing it down is going to make, again, this thought, I can see it now. It makes it feel more manageable and malleable. So this thought is coming to me like it's 100% true with an exclamation mark, right? See the exclamation mark I read. But there's some problems with this thought now that I look at it. It has extreme language, everything. It's stuck in the past, right? The wandering mind, I've lost, right? That's a past thought. It's going to make me feel sad. So I noticed the exclamation mark. And now what I'm going to do next, please, is I'm going to change that exclamation to a question mark. I've lost everything. I've lost everything. So when we question a thought, when we use this punctuation, it forces us to think about why it's true and why it's not true, right? It forces me to challenge the validity of this thought. So naturally in doing so, next slide, please. Yeah. So I don't think this because I'm crazy or delusional. There's reasons why I feel like I've lost everything, right? Next slide. Well, maybe I've had to stop working. I've lost independence, right? So there's some, not crazy, there's some reasons why this thought came to me in the first place. So first I think of reasons why I think this way. Because I don't want to dismiss how I feel, right? Because this is a hard situation for me. Next. But because it's a question mark this time, I have to think about reasons why it's not true, the other side of the coin. So I've lost everything. Why isn't that true? Next, please. Well, I haven't lost everything. I still have my family and my friends. I still have my spirituality. I've even gained gratitude. I'm more appreciative now. My body's still working hard. So I guess I haven't lost everything, right? Because now I've questioned the thought. And so this is an opportunity to say, well, I guess I've lost everything. Now that I'm looking at it, now that I'm analyzing it, it's not useful to me. And we don't have to keep useful thoughts, right? When we keep useful thoughts, we learn them. Like you put a song on repeat, you're going to learn the words. So instead, this is an opportunity to replace this thought that's not true, I've lost everything, with a thought that's more useful and more realistic. Next, please. So instead of saying to myself, I've lost everything, maybe I can say, I've lost some things and I found some things, right? Whatever that thought is, you want to make it realistic and you want to make sure that you don't have to dismiss how you feel. You don't have to be delusional about your experience, but select a thought that's more useful to you and serves you. Telling yourself you've lost everything does not serve you, it only makes you feel worse. Telling yourself that you found some things helps you feel more positive, and that you've only lost some things makes you feel more hopeful. Next, please. And the last thing, I know that we're coming up on time, is I want to talk about self-compassion. I want everyone to know and remind themselves that they are doing their best. People do not wake up and say, hey, please sign me up for a day where I have lots of problems and I'm doing my worst. That's not how people work. People are doing their best, and your best is going to change depending on situation. It's going to change moment to moment. It's going to change based on your abilities and your resources. So your best when you're tired looks different from your best when you're not tired, right? So don't have this very rigid definition of best. Give yourself some grace. Be kind to yourself. Self-compassion is making sure that you're connected, is being in the present moment and not judging yourself when you are feeling sad, worried, fearful, and it's remembering that you're resilient. So I thank everyone for their time. Next slide, please. And there's enough Thrive for everyone, right? Feel free to play around with some of the techniques and information we talked about today, and it's enough Thrive to go around. Keep thriving, everyone. Thank you so much for your time.
And thank you so much for such a great webinar. There were so many tips. The way you presented information made it very easy to understand, and so thank you so much. I also want to thank APA for their partnership in this program, and I have not seen any questions, but it's open. If anyone has questions, please put them in the chat box, or we have Manna's information up on the screen, so feel free to contact her directly if you prefer. But again, thank you all for joining us today, and thank you so much for your great presentation today.
Thank you for the opportunity. Be well, everyone.
Yes, we appreciate everybody being here, and please join us next month, getting to know what your blood pressure means, what your lab values mean. We hope to see you then. Thank you. Bye-bye.